Hello, aesthetics lovers. I'm Laura from the Samra Group. In this segment of Jeunesse Me, I'm here with Dr. Saeed Samra, founder of Samra Plastic Surgery. The cosmetic, reconstructive, and hand surgery practice has been in business for almost 40 years and has grown to include 5 board-certified plastic surgeons in 4 locations throughout New Jersey. Dr. Samra was also the first in Monmouth County to open a medical spa which offers Botox, fillers, CoolSculpting, and facials. Jeunesse Medical Spa also offers Ultherapy, the non-surgical lift for face and neck. Today, Dr. Samra will answer the top 3 questions he receives about Ultherapy. Hello, Dr. Samra.
Hi, how are you? Thank you for giving me the opportunity to talk to people and tell them what I know about Ultherapy.
Well, thank you for being here. Our first question from our patient is, what is Ultherapy?
So Ultherapy is an FDA-approved skin tightening procedure that applies mostly to face and neck, and it essentially uses the power of external ultrasound in heating subcutaneous tissue at different levels based on the transducer that we use on the equipment to heat that layer and cause it to rejuvenate itself. And it creates new collagen and it tightens. It does that slowly but surely, and it is known that to get the full effect of Ultherapy, it takes anywhere between 3 to 6 months. So it's a slow progress, it works, and it is successful. Of course, it does not do what a surgical procedure will do. It will not do what a facelift or a neck lift will do, but it does work. And in certain instances, people want to avoid surgery for many reasons, but this becomes a good choice for them. Amongst the advantages of this is that there is no true downtime for the procedure, so people can have this and go on with their life, whether it's a professional life or personal life. They can do their own thing just about immediately after. And there are no significant risks at all. There is no cutting, there is no bleeding, there is no anesthesia. It eliminates a lot of the things that make it much more complicated, even safe, but more complicated than Ultherapy. The typical patient is a lady who was an insurance executive whose daughter was getting married 4 months later, and she told me that she couldn't take a day off to have surgery. She was very busy in her work and wanted to have something done, and Ultherapy became the choice. And of course she was very pleased with it because we have expectations that are not those of a surgery tightening, but it is yet very effective and helpful.
Okay, I think we've hit a little on question 2, which was, why do women choose to have Ultherapy? Are there other reasons they may choose other than, time factors or not wanting initially to go under the knife?
Well, like I said, no downtime.
Mm-hmm.
Bruising from this procedure is extremely rare,
Mm-hmm.
although it could happen, especially if someone is on blood thinners, and it's quite limited if it did happen. And there is no post-operative limitation of activity. There's nothing to it. It's just that it's a slow, gradual improvement of what they started with.
Okay, and finally, the third question that most patients ask is, what does Ultherapy cost?
It is a lot less costly than surgery. There is no facility charges for Ultherapy. There is no anesthesia charges, and the fee for the operator is a lot less than that of surgery. But the cost really depends on how big of an area we treat, and I have the machine behind me, and you can see that Ultherapy treats the cheeks, treats the upper neck and the submental area, it treats the lower neck, and then with different modules it treats the outer forehead, it treats the crow's feet, it treats the lower eyelids and the cheeks, and it treats the perioral area. So really it depends on what the patient's concerns are. The cost of the treatment and the time that it's going to take to do the treatment is going to depend on what they want. Vast majority, in my experience, of people want to have their upper neck and submental area and or their cheeks treated, but others want a lot more than that.
All right. Well, I think we have enough information for today. Thank you so much for your time.
Thank you so very much. Appreciate it.